Hello, I'm Dr. Lauren Hyman, and welcome to Scooch Down, where you can talk to your gynecologist like you talk to your friends. Today we're going to talk about heavy periods, the bane of many women's existence. I have patients come in all the time to tell me that they have periods that keep them home for 1 or 2 days. They can't function, they can't do all the activities that they need to or want to do because the bleeding is so heavy. The first thing is an evaluation. Why is the woman getting heavy periods? And we can divide that into 2 different categories. Is it anatomic? In other words, is it because of something going on in the structure of the uterus? Either there are fibroids in the uterus is large, there are other conditions that can be causing heavy bleeding, possibly a polyp. The other scenario would be hormonal. The uterus is normal in size. There are no polyps, there are no fibroids, there is nothing going on other than a hormonal issue causing the person to have extremely heavy periods. So that evaluation helps us know where to target our treatment, of course. Well, once the woman has had the evaluation, which may include an ultrasound to look for fibroids, would certainly include a physical exam to see if there's any polyps coming out of the cervix, sometimes includes a biopsy of the lining of the uterus to rule out anything dangerous, and might even include a trip to the operating room for a camera in the uterus to look for polyps in the lining. After all of that has been ferreted out, what are we going to do about it? Well, let's take out the category where there is actually something physically wrong and just look at the category where there's nothing wrong. The periods are just extremely heavy. We can approach this in several different ways. The first thing we might want to do is nothing at all. Watching and waiting is always an appropriate response, but if the woman's getting too anemic, we may need to take action. The second idea would be, if hormones are causing the problem, to put the woman on some type of hormonal treatment, either a low-dose birth control pill or progesterone for a certain part of the cycle to try to decrease the heaviness of the bleeding. Let's talk for 1 second about the cycle. In the first half of the cycle, the ovaries are making estrogen. That builds the lining of the uterus. In the second half of the cycle, progesterone is stabilizing that lining of the uterus. And when there's no pregnancy at the end of the cycle, the hormone levels drop, the lining of the uterus sheds. And again, for some women, that can be extremely heavy. So birth control pills can help mitigate that, help decrease the thickness of the lining of the uterus so the shedding isn't as heavy at the end of each cycle. Sometimes a progesterone at the second half of the cycle can help decrease the thickness of the lining, again, so the periods are not heavy. Hormones might not be in the cards for you. What are some other treatment options? Well, there is a medication that affects the clotting cascade that you only take during your period during the very heavy days up to 5 days, and that can be a very effective treatment for some women. Also, back to the hormones, if we don't want to use a birth control pill, we can use an IUD that secretes progesterone to help decrease the heaviness of the bleeding. Finally, we get to surgical options if hormonal options have not worked or they're not in the cards because of different conditions a woman might have. Surgical options can include a D&C, though with truly heavy periods, sometimes that is only temporary when we thin out the lining of the uterus, because after a few cycles, that lining can grow back. Some women do well with something called an ablation, where we actually burn. We try to actually get rid of the lining of the uterus. Some techniques include freezing the lining or heating the lining to try to really get rid of that lining so at the end of each cycle, it's not shedding. And finally, once we've availed ourselves of all the options, if the bleeding is really out of control and the woman is done with her childbearing, a hysterectomy might be considered as a final option. Of course, that is a last resort. So at the end of the day, when periods are very, very heavy, there are many, many, many things we can look into to do something about this situation, which is absolutely not acceptable for the majority of us. So talk to your doctor, talk to your gynecologist, consider all of the options, first steps in evaluation, and then let's do something about it. This has been Dr. Lauren Hyman on Scooch Down. Thanks for listening.